Hello, hello, everybody. Thank you for joining us. Thank you for coming in. It is now 12:01, so this will commence the start of our third pop-in. Today, we will be continuing the pop-in series for our CREP 101 initiative. Today, I will be joined by Dr. Anita Malui, who will be covering the topic of food and culture. So listen in a little bit about her own experience and about how food and culture affects our communities and the health and the overall health of all of us. Thank you for joining. I hope you enjoy.
All right, thank you. Thank you, Miss Bell. Good afternoon, everyone. Happy Wednesday afternoon here at CECG, Community Engagement and Consultation Group. So a little bit of about our nonprofit. It is an organization, tax exempt, 501c3, located in the Capital Region, Maryland, Washington, D.C., Virginia. And thank you again for joining us. This is our fourth pop-in CREPS initiative. And today's topic is about food, culture, and health. So I'm very excited to be presenting to you today. So let's take it on. All right. I will move the slides here. All right. So the influence of culture, food, and health. So we have these beautiful pictures in the background. Hopefully everybody can see that and they can relate to that. That's already making me hungry because it's lunchtime. So when you look at that, what comes into your mind? Let's take a field trip around the world and think about the different foods you have tested, eaten, different from what you usually eat. That includes those exotic foods that we are not accustomed to, but then you look at the food and you want to try it because maybe it smells good, it looks good, the color is inviting. So think about that and how food is accessed, prepared, and the meaning behind each preparation. So for a lot of cultures, food is the core of togetherness that brings everybody together. But at the same time, food also can impact on our health outcomes. Despite the fact that, we all gather around food, very communal, for example, I grew up in an environment whereby food is celebrated. Food brought us together. Food brought friends together. But at the same time, we never talked about how food can impact our health. So the topic today is really to think about, how culture influences who we are, how culture impacts our health outcomes, and the whole meaning behind food. What do we need to know? So as you take that road trip around the world, I want you to think about the places that you've traveled, different countries or events you've attended, or even going to a friend's house who is not like you, who probably is from a different culture, and the food that was served there. Think about all that. All right. Let's see, next slide. So we'll talk about, my own experiences here. First of all, we have our beautiful pictures in the background there, that also addresses some of our experiences. So most people are identified by their cultural foods, as you can see. How do we find a comfortable balance between the foods we grew up eating, our identity, and health outcomes? This is where you start thinking about, how food has impacted us. There's processed foods, foods that are packaged foods that we get from the stores. How do those foods impact or influence our health outcomes? Food in general is a unifier that connects us across cultures and generations. We've all had those moments when we felt something that reminded us of our childhood, and that's food. especially, in this era of migration, where a lot of people migrate or travel to different countries. Then then suddenly you have this craving of a food that you grew up with, a food that you're most familiar with, or a food that you really want to have, right? And immediately it takes us back to that place, a place where our roots started. However, let's think about health here, especially, where we are prompted to look at nutrition labels, because a lot of prepared foods, we may not know how it was prepared, what's in that food. If you are a person who's on a restricted diet, and you have to think about what you eat and how that impacts your health, how would you know the proper balance? How would you find the proper balance of the food you're about to eat and your health outcomes? And that's the topic for this pop-up. Food is literally propels us to also consider what our doctors tell us what to look out for. If let's say you're a diabetic, and you are asked to watch what you eat, yet you are in an environment that does not provide details on how that food was prepared, what ingredients went into that preparations, what do you do then? So this is where, culture becomes a little bit of a challenge, and it ends up impacting our health outcomes. As a provider personally, I find it very difficult sometimes to convince my clients on changing their diets. And a good example I can share is I remember one time I was facilitating a nutrition class, and I would say 80% of my audience grew up on palm oil. And we know that palm oil it's very tasty. For those who have tried palm oil in their cooking, it is very tasty. However, there's also consequences, with eating too much of that. So the more I explained on how to reduce it, or how to substitute it with something else, let's say olive oil, I literally got a pushback from the audience, telling, oh, my parents or my grandparents grew up on palm oil and they're still alive and all that, so it really made me understand even more of the impact of cultural foods on our health. Yet, the audience was more hesitant to thinking of the alternatives on how preparation. But anyway, to make the story short, we ended up with a food demonstration. So we had a food prepared with palm oil, and then we also had food prepared with olive oil. And then we asked the audience or the participants, what is the difference? How do you, is in terms of difference in terms of tasting, how it tastes? And quite frankly, most of them responded with that there was a very, very slight difference in the way the food tasted, because it was all tasty, despite having been prepared with different types of ingredients. So anyway, at the very end, we decided that, what, it's always a good idea to find some alternatives when it comes to food preparations, especially, if there's a health concern, a health scare. Because a lot of people that we see in our communities, in our circles, some of those people don't even know their health backgrounds, the generational health, what does it look like? So, and that's the experience that I had. But for the sake of this presentation, think about your own experiences or what's going on with you right now. If you have any health concerns, what do you eat and how has it impacted Or are you having even a difficult time finding those the alternatives to better health choices? And that's why we're here, right? So let's move my slides here. All right, so for the discussion objectives, we will understand the influences of culture on health and also understand the factors impacting multicultural healthcare. So think about your own culture again and the foods you grew up seeing and eating, or where you are right now. That's a whole idea of this presentation. And as you also think about these objectives, what you want to learn from the objectives today. The influences of culture on health. And what about multicultural healthcare? If you've ever gone to a clinic and let's say your provider is somebody who looks or who is different from you, who probably speaks a different culture, who speaks a different language, a different language from a different culture. And the questions they ask you, those health and physical questions they ask you, how do you answer those questions? Do those questions have even a culture component embedded in that? Or the conversations you've had with your provider, what questions do they ask you? How do you even get a chance or an opportunity to talk about some of your challenges you have, especially where food culture and health, comes into conflict? Do you have an opportunity to talk about that? So let us know, let us know in the comments. You can put that in and we'll be able to answer that. Okay. All right. All right, so the definitions here, I want us to also talk about the multicultural health. What does that really mean, multicultural health? So multicultural health is a phrase used to reflect the need to provide healthcare services in a sensitive, knowledgeable, and non-judgmental manner with respect for people's health beliefs and practices when they're different from your own. And this is again is for providers, for just like I mentioned earlier, if you have been to, for those who have been to a clinic, you've gone to a health and physical, or you go for your annual checkups. You're very different. You're different from your provider. What are those providers asking? How are you communicating with them? What are those questions that are usually presented to you? So as a provider, this is an opportunity to be knowledgeable in a non-judgmental manner when especially our clients are different from us, right? And because our clients' health beliefs may be totally different. Because we are here, as a provider, I'm here to prevent diseases. But do our clients understand that? Are we able to ask our clients, some of those challenges they're experiencing? How do we advise our clients? Okay. So multicultural health, why is it important? Why is it important? Now, from a provider's perspective, it's important because it helps improve health outcomes and quality of care. And this also can contribute to the elimination of racial and ethnic health disparities. Very important. And again, let me take you back to 2020 when we were first exposed to COVID-19, right? There was so much going on. And, many of us, including myself, we were still wondering, what is this? What is it? What is this? How do we address this? There was a lot of hesitancy, especially when the vaccines first came out, whereby, now the multicultural competencies had to kick in. I remember sitting in a webinar with the CDC whereby we were being encouraged to reach out to our communities, our racial and ethnic communities, and talk about the vaccine's importance of having the vaccine. So the cultural competencies, and that's why with this conversation or discussion, it's important to also dive into the multicultural health. What does that mean? Is really having the culturally appropriate or culturally competent information literature, so that our clients can understand that. And this is all again under the multicultural health. And again, to provide culturally appropriate literature and training that also accommodates our diverse communities, aimed at reducing barriers to patient care. That is why this is very important for us to really understand, the definitions of multicultural health, particularly to both providers and clients. And feel free to put any questions, any comments in the chat, and we'll address that. All right. So influences of culture on health. So as you can see in the background, it's a beautiful picture. And some of you may be familiar with the type of food on there, or getting hungry now since it's lunchtime. But it's all for the discussion to really get us going and think about, what other ways can we really think of how to jump over this hurdle on health and culture, and how both come into conflict. So health in general is influenced by the environment, our genetics, and socioeconomic, socio and cultural factors. Everyone has a cultural background. I've traveled around the world, so many different countries, come across so many different people from many, many different backgrounds. And of course, everybody has a very different, unique way of how they identify themselves. But again, our environments also have a big impact on how we are influenced, the socioeconomic factor. And that means your ability to access some of the things, some of the essential resources that are needed to make us better. And of course, again, the cultural component to better health outcomes. Culture in general is defined on what we think, how we say things, and how we do things. Totally different. And the funniest example I can give you, back in the days when I was facilitating the multicultural competency course, I always talked about here in our immediate environment, how even the streets that we live on really divide us, and how we identify ourselves, just because you have that big corridor between us, right? You have, for example, you have one side of the street, it has a different zip code, and the other side has a different zip code, of course. And also that may also determine your accessibility or opportunities that you have based on the zip codes. So that could also be considered a uniqueness within a cultural component, even accessibility of essential resources, right? So think about also the language. Language is also culture. Stories that we tell, could be also part of a culture. The myth, things that we have heard in the past, how do we relate with it? How do we relate today in present day? Lifestyles, behavior, even behavior itself. I remember also back in 2020, when the pandemic first started, we had many of us, we have friends who were using concussions. Concussions was a combination, which is actually also a myth. It was a combination of garlic, fresh garlic, ginger, honey, lemon, right? And this was a myth that it would cure COVID. And a lot of people, you go on the internet, you go on the TikTok was one of the places, the platforms where people were showing what they were doing to prevent themselves from getting COVID. That was a myth. Then you find that, how does that relate to the culture? Of course, the cultural background of people who are using this myth to spread their beliefs on others. That's an example of how we identify the influences of culture on health outcomes. All right, let's see here. I have my notes here that I wrote. And secondly, culture can impact the perception of health and illness, beliefs on what a health issue is. There's been situations whereby sometimes, it's hard for us to believe and understand that that's actually a disease condition that is as a result of not being able to either manage your weight or manage your blood sugar. Then we are able here, we find the scapegoat and use culture as the reason why we shouldn't believe that, right? And so it's really becomes very difficult for a provider to really hone in and advise a client on the scientific findings on how to prevent a disease. And also, the influence of people, how people perceive or how people should talk about that illness. I find a condition like diabetes, right? Sometimes it's very difficult for some folks to talk about that. And you would see that that's a normal thing, at some point in life, because of the way we live, the processed foods, some point everybody may end up getting diabetes, right? But you will find that some people don't even want to talk about that because they don't want to be associated with that. So how you as a provider or you as an individual come to terms that let me talk about that, let me educate other people, let me see how I can use my own experiences and talk about what's going on with me and how I should approach this without being judged or without imposing my own cultural beliefs on that person. So then you'll find that culture also can also it literally can drive us to our own death if we don't address some of the issues that we have, especially when you've been prescribed an appropriate treatment for your condition. So as a provider, again, this is where my cultural competencies for anybody who works in a clinic, cultural competencies kick in to be able to provide some of these treatment plans based on people's beliefs, but again, accommodate them as we are bringing in the scientific findings to complement what they are used to. So it's also important to recognize, accept, and respect cultural similarities and differences, which is also an important aspect in the delivery of effective health outcomes and services, also the abilities to provide within a cultural context. Now, in my training, I've always known that, and this is also a continuum because with the professional development that we take on our annual base, this is very important to have that continuum of understanding the different beliefs and why people are hesitant in either getting onto a treatment plan or going to their providers and actually talk about some of their challenges. Because there's a lot of biases as well. That's a topic for another day, biases on some of our backgrounds. Okay, let's see. Next slide here. So what are some of those factors here? Let's see. So what are some of all those other factors impacting effective outcomes? What are some of your other factors? What are your factors? Because we are unique, especially when it comes to our everyday life, we are very unique. Our health beliefs, as I mentioned earlier, we are very unique. How we perceive, how we understand, and how we also take in the information that's given to us. So there are a number of factors that impact effective health outcomes. One of the factors is language barrier. It's an important factor here. Language barrier meaning that, if you in LEP, limited English proficiency individual, and you're having challenges with understanding some of the literature that is being provided to you, definitely is going to impact your health outcomes. And here in our organization, we are fortunate enough to translate literature in different languages because, where we are located, you will find that, there's over 50 languages spoken. So in order for us to even to have an impact within the community, we have to make sure that, a lot of our literature is translated in languages that people can understand, right? And also having folks on staff that represent communities that we serve. Okay, that also helps to reduce some of the barriers of access, communication skills as well. You have the communication is also key because, a lot of us, most people who have migrated, when going to a doctor or a hospital, you find it's very difficult to really to effectively communicate and say what's going on with us. We rely more on the provider to come in with a diagnosis after maybe a blood draw or some kind of a marker that they may find and tell you, Dr. Molui, this is the result of your blood work. You've been diagnosed with an XYZ condition. But without us communicating and sharing some of our background health scares, especially, with genetics and family history, it becomes very difficult for a provider to really hone in to what exactly is going on other than just relying on, a blood draw. Another one is universal cultural patterns and norms, which we have addressed. You will see that, definitely, the cultural patterns and norms are one of the biggest or among the biggest, challenges when it comes to effective health outcomes. Anytime a cultural norm is put in front of health, you'll find that, it'd be very difficult for you to have a better or a desirable outcome. Especially, if you have a chronic disease that eventually leads to complications like diabetes, not being able to address that because it's a simple thing of food and understanding how food and the body, have to be manageable. You have to have that balancing act in order for us to have a better health outcomes and understand how to balance the food as well as, understanding getting the best out of what is being provided to you. And we also have the health beliefs as well, which also ties into the culture. You have the acculturation, continual factors or level of cultural adaptation. This is tied to migration. Many people have migrated to different countries around the world, either for economic betterment or for education. So if we don't understand the host environment and how the healthcare system is structured, that also may impact our health outcomes. So it's also among the factors impacting effective health outcomes. Now, there are a lot of countries, including, here in the United States, where you have to have health coverage, insurance, meaning insurance, in order for you to see a physician. And then you have some countries where healthcare they have a universal healthcare, can literally go anywhere and be covered. So if we don't know how the healthcare is structured, the healthcare system is structured, then, definitely it's going to affect our health outcomes. Fortunately, within communities, and I will use us as an example, here in the DMV, the Capital Region area, we have a lot of CBOs, the community-based organizations that really are there to disseminate information, access to resources, link people, community members to different resources within the community, even to healthcare providers. We are very fortunate to do that. So we really educate our clientele on how the healthcare infrastructure is structured. Even those who don't have insurance, uninsured or underinsured. So we have a lot of resources, which I will share at the very end. Then what about the alternative treatments? And those are the beliefs that we have, the myth that we have, our own stories from ancestry stories. How do they impact effective health outcomes? So alternative beliefs will be, I have a headache. I may tie it to, let's say, working very hard, not having enough sleep, right? And then let it go. Take your over-the-counter Tylenol, let it go. 2 days later, same headache comes back. Probably I'll just sleep it over or drink ginger tea, right? And let it go. But then it keeps on coming back. Then later, after probably 2 months, and this headache has been going on and off, and you have this alternative treatment and not really seeking advice from a provider, it's definitely, we don't know what it is. So it definitely is going to impact health outcomes. So this is what we tell our clients is an opportunity to talk to your provider and kind of communicate to them, this has been, on and off, it's been constant. It has been, sometimes occasional. But it's come to a point whereby it's been long. We need to maybe do something else. Draw some blood and see if there's something we can disclose or find a treatment plan for. We don't know. So again, as I go through all these different factors, you'll see that there's a lot of overlapping on these things. And it's just a matter of being educated, educating our communities on what to look out for. Again, how to communicate some of these challenges that we see or our experiences with our providers. There's also an issue of access to a knowledge of services, which brings us to knowing your resources within community, or talking to somebody who has a good knowledge of what is available and what's accessible. So access to resources is one of the hardest thing. Again, if you are a person of LEP, limited English proficiency, or a person who doesn't you'll have other barriers like transportation. You live in a rural area where there's really, there's not as much on the hour transportation. It's going to be very difficult. So accessibility is also a factor that also impacts our health outcomes. And nowadays, the newest is the connectivity with technology. You find that a lot of providers are engaging into telehealth, right? So even if you are in the, within the urban areas, and you don't have that connectivity to access the telehealth that your provider or a clinic or federal qualified clinic may have an option for, then it's going to impact your health outcomes because you're not able to communicate or to visit, virtually with your provider. So it's a factor that can actually impact effective health outcomes. Then also you have factors such as, client support knowledge. When clients don't know when we don't know that there's support within an environment or community, then also it can impact, especially, when it comes to diseases such as, the cancers, there's a lot of support systems out there. and either it's group support systems or therapy, then definitely, what could have been prevented from going real bad may end up being, detrimental for an individual, which eventually will affect the entire health outcomes. Then, of course, the one that is big for me is a staff knowledge, competence and support. Providers also need to have the competencies, culturally competent knowledge, which is awareness of cultural differences, having the non-judgmental component to service delivery is important for the client outcomes. That's where our biases come in, understanding the biases, even internal individual biases when we are with our clients. How do we check ourselves, into when we are with our clients, because, when our clients, see us and we're being judgmental, definitely is going to affect their health outcomes. So it's important for us to know that as provider that, our own biases can be also a factor that can affect our clients' health outcomes. All right, let's see. Now we are 12:37. If we don't have any questions, I am going to go through. Usually with these pop-ups, we give about 20 minutes for answering questions and sharing resources. But let me go through some of the resources that we have here at Community Engagement Consultation Group. As you can see, we have a lot of resources, which we can share. Always reach out to us. The email to reach out is health@ce-cg.org. And the number we have here is 301-525-8807. That's the main landline. It's 24 hours a day, so you can reach out and we can always refer you to one of our partners within the community. So hopefully you've enjoyed this, but we do have partners that we work with. We work with Mana Health, Mana Food, where we refer our clients, who are struggling with our food insecurity, and the food is provided on our monthly basis, I suppose, right, Miss Bell? Monthly basis. We also have Rainbow, who we refer our clients as well. And I'm also happy to share that, we are a SNAP recipient, as a community outreach provider. We link our clients to SNAP food resources, and that's for food. Now, let me go to other resources that we have for our clients who don't have physicians to see, or you have a physician but you're not comfortable with that physician, or you want to explore other resources. We do have the resources for you. We have a partner, Black Health, the Black Health Physician Network, which is over 100 physicians in that network. We refer our clients to that as well, for those clients who really want to explore and really get a one-on-one, especially, in this era where we are not too comfortable with some of our diagnosis, we need a second opinion. We also have the Mobile Med Clinic, who is our partner on one of our grants. So if you reach out to us and you're looking for, let's say, behavioral health, you have a chronic disease that you cannot, you're having trouble with managing, please reach out to us. We'll refer you to one of those, either Black Health Physician Network or Mobile Medical Clinic. And we also have our Home to Home is a resource for those who are looking for to startup items for a new home. We have that, and then you'll be wondering, how does that impact health, culture, food, and health? Yes, it is, because when you look at the entire social determinants of health, you'll realize that the essential items, the essential resources, is what actually makes us whole. More like a whole person health. If you think about that. So we do have, and other resources, including workforce training, which also is also a component, of how we access and our abilities to access certain things. So if you have a good job, you know that a lot of good jobs come with benefits, and one of the biggest benefits is health, health insurance. So I talked about, the adaptation of, you know, um, uh, the healthcare system, understanding that. So health insurance is within the healthcare system, right? So it's important, to understand, the entire social determinants of health and the different components that make that up. And that's where also our resources are structured, they really complement each other. So anyway, it's a 1:45. If we don't know, do we have any questions?
I did have a question. Could you touch on understanding nonverbal cues that may be culturally motivated as a means of better understanding a community?
No, I did not touch on that, but that's a good one,
I mean,
and
could
that's
you
also,
touch?
yes, yes. So I'm happy to do that. So, nonverbal cues, and that's what I always, also when I'm training folks on how to communicate with our providers, even providers themselves within the service delivery aspect of patient care is it's not just, verbally, listening to a client, but also you're observing the body language, which are those are the nonverbal cues. There will be a change, the facial change, or even the way they are seated. That will give you a clue on what's going on. And that's why I love my PCP, primary care physician. I've been going to him for 20 years, and he looks at me and said, Anita, is there something else you need to talk about? Because I see you a little bit hesitant. And that's what I always tell, clients that, what, or even providers that, look at the body language. Because a lot of clients that we see, they're LEPs, right? Limited English proficiency, which actually makes it very difficult to communicate. So if you see that there's a crunch or there's a facial kind of a crunching in the face that, oh, no, that's not what it is, then that's an opportunity to engage, right? And I take it back to the forms that we all fill out, the history and physical, whereby they ask you, do you have diabetes in your family? Do you have heart disease in your family? Do you have all these things? Let's use that. So when we use that in my class, we use that, asking clients to look at that and see what resonates with them. So if we are having a difficult time, or we're a little bit of shy to talk about some of these things that, we have, use that as an opportunity to discuss what is going on. Otherwise, if we go to a physician's office, or you as a physician or provider, you see the body language, ask the questions, or even go through the entire form. Does that make sense? And we know that physicians have very limited time, and I think, when you look at some of the statistics, it's literally they only have 5 minutes with a client. That's it. 5 minutes with a client. But this is what I always tell my audience, that before you go to a doctor to see your doctor, make sure you write down notes, things that you want to ask, so that you have it up front. Let the nurse or the medical assistant who's taking your vitals before the physician comes in know that I have additional questions for the doctor. There the doctor comes in prepared for extra time with you. It's very important. That would address a lot of your questions. So by the time you get out of there, you know that, yes, at least, some of your questions have been addressed. So, yeah. Any other questions?
There's one more question. It said, I am aware of the negative health impact of high fat and sodium foods. However, my mother is the main cook in the house and continues to cook using these ingredients. How do I help her embrace a change to improve the health outcomes of all of my family members?
Well, that's a great question. Now, if you like we mentioned in the beginning, this is our fourth pop-in for the month. If you go on our website, we've archived even our YouTube channel. We've archived, the other pop-ins that we had, which actually address that it's a nutrition kind of question, which we can answer now, but it would be better for you to go to our archive recorded session. So really to understand the nutrition, of course, sodium, we know that sodium is big, especially with our heart patient clients. It's always good to understand nutrition label reading, which we had one-on-one reading and understanding, how much sodium is on the labels. Very important to understand that. Even when it comes to, the cooking itself, you have saturated and unsaturated, oils or fats. You really need to understand those. So I'll refer you back to the recorded sessions that we had that will give you a better understanding from the beginning to the very end. Yeah. All right, so please stay tuned for the upcoming. Let me just stop sharing so I can have, All right, so please stay tuned for the upcoming February. February will have a whole new series of different pop-ins, and this is to engage our communities. This will to engage our communities. Every Wednesday will be from 12 to 1 p.m. Is it 12 to 1 p.m.? Yeah, that's right, 12 to 1 p.m. Sometimes I forget it. There's so much going on. 12 to 1 p.m. And the whole idea is to continue these trainings or these workshop series during this lunch hour to have folks, ask questions, come in, share, and we welcome all the sharing that you may have. And yeah, thank you, Seth. Thank you very much. You have the rest of the day. Have a good day.